As the lead Democrat on the Health, Education, Labor, and Pensions Subcommittee for the Education and Workforce Committee, I appreciate you all joining us today as we discuss what millions of Americans already know, that health care in this country is deeply unaffordable. Unfortunately, it appears that the only people who don't know this are our Republican colleagues, who at this very moment are refusing to stop an impending massive spike in health care costs that working families in America can't afford. During the longest government shutdown in our nation's history, Democrats fought for an extension of the Affordable Care Act's premium tax credits that keep coverage affordable for over 20 million Americans. Without this extension, households across the country will face skyrocketing premiums and be forced to choose between paying their rent and seeing a doctor. Over the past few weeks, many families have received renewal notices showing dramatic increases in their premiums, copays, and deductibles. In the district I represent in California, which is the fifth wealthiest House district in the United States, over 33,000 people will likely be priced out of the health insurance market because of Republican inaction. For a family of four in California's 10th district earning $130,000 a year, their premiums would rise by about $18,000. Needless to say, even in a wealthy area like that families cannot afford this. After many painful weeks of silence from the other side of the aisle, we have finally reopened the government upon the condition that Republicans come to the table and extend these critical ACA premium tax credits. Now it's up to us to hold Republicans accountable and ensure that working families aren't left in the lurch. That's why we're here today. Our Republican counterparts have not held a single hearing in this committee on the realities families are facing today with the expiration of the enhanced premium tax credits. So we're having to do it ourselves. Today we'll hear from healthcare experts, small business owners, and those who enroll in the ACA marketplace about how these tax credits affect their finances, their access to care in their lives, and discuss what we can do to make healthcare more affordable and a higher quality. We live in one of the wealthiest countries on earth, and yet too many families fear a trip to the emergency room will bankrupt them. Our healthcare system has been broken for too long a period, and Americans are struggling under the current status quo. Congress must take bold action to make healthcare and prescription drugs affordable for every American family, not just the wealthy few. And it's not just healthcare. Across the board, the cost of living continues to rise. Working families are paying more for groceries, housing, and other everyday goods. While working people are struggling to get by, people like Elon Musk is slated to earn more money each year over the next 10 years than every American teacher combined. But instead of working with Democrats to bring costs down, Republicans have chosen to cut Medicaid, threaten Medicare, and gut the Affordable Care Act. As a former small business owner, I know that healthy employees with good benefits are essential to the success of any business enterprise. The ACA marketplace ensures that workers at small businesses can get those benefits. That is why I'm excited to hear from folks here today. If we are going to build an economy from the bottom up and the middle out, we must listen not only to policymakers in Washington, but also to the folks on the ground to ensure that our policies actually address the needs of American workers. Our work is far from over. We are continuing the fight for affordable, accessible care for every American, because that's what this is about. So thank you for being here today. I apologize for being late, and I look forward to the productive discussion. With that, I am pleased to introduce our panelists. First, Justin Ginovelli is an associate research professor and project director at the Center on Health Insurance Reforms within the McCourt School of Public Policy's Health Policy Institute at Georgetown University. He studies private health insurance and the effects of the Affordable Care Act on consumers. Also, Katie Berg is the Director of Federal Affairs at the Blood Cancer United, formerly the Leukemia and Lymphoma Society, where she leads advocacy efforts to ensure patients have access to affordable, comprehensive health care. Terry Baggett is an entrepreneur and owner of a small letterpress printing business in Pittsburgh. Tori relies on affordable coverage through Pennsylvania's state-based marketplace known as Penny. And Kathleen Winters is a small business owner operating Duella Service Company for new mothers in Newport News, Virginia. Kathleen relies on the AC marketplace for her health coverage. I'd like to ask all of our panelists to keep their opening remarks to 5 minutes, and with that, I'll recognize Professor Ginovelli. Welcome. You have 5 minutes.
Thank you so much, Ranking Member DeSaulnier, Ranking Member Scott, distinguished members. I appreciate the opportunity to join you today. My name is Justin Giovanelli. I'm an Associate Research Professor and Project Director at the Center on Health Insurance Reforms at Georgetown University's McCourt School of Public Policy. I study private health insurance and how it is regulated by the states and the federal government. Fundamentally, I do this to understand how state and federal policies can be made to help coverage work for regular folks, for regular people, and try to understand how policies affect access and affordability of healthcare coverage. The views I express this afternoon are my own. So the millions of Americans who are not eligible for health benefits through their employer or through a public program such as Medicaid or Medicare look to the individual market for coverage. Prior to the Affordable Care Act, the individual market was dysfunctional. It did not work for folks. It was not accessible, affordable. The coverage it provided was not adequate for the people who needed to rely on it. The ACA was designed in part to remedy these flaws. Part of the way the law did this was by establishing basic consumer protections for people. Rules that say that insurance companies can't deny coverage based on pre-existing conditions, that say insurers can't impose annual or lifetime limits on how much care they'll pay for if you get sick. Another key part of the law was the premium tax credit. The premium tax credit gives consumers a fixed amount to pay for coverage on the ACA marketplaces. The amount of the credit depends on a person's household income. It was good sense to try to make coverage more affordable by using a premium tax credit, but the original design should have been better. Financial help used to end abruptly at 400% of the poverty level. If you earned under this threshold, you got help, although often not enough. If you earned over that threshold, which is about $63,000 for individuals next year, there was no help at all. Congress acted in 2021 and 2022 to address these shortcomings by creating an enhanced version of the premium tax credit. The enhanced credit is relatively higher for everyone who is eligible for it, and how much assistance you get still depends on your income, but there's not an eligibility cliff. The credit winds down as your income goes up. The enhanced premium tax credit has put coverage within reach for millions more Americans and has contributed to a doubling of enrollment in the marketplaces since 2021. Some 23 million people had marketplace coverage earlier this year, and more than 90% of those folks relied on the enhanced credit to afford that coverage. We're here today because these benefits, these enhancements, are going away. Earlier this year, Congress extended and made permanent, in some cases, numerous tax credits that were otherwise set to expire, but not the premium tax credit. Without further action from Congress, the enhanced premium credit will end at the end of this month. Without the enhancements, the eligibility cliff will return. Millions of middle-income consumers will lose access to the credit entirely and see their premiums jump. Without help from the tax credit, people who live in places where the cost of coverage is relatively expensive will, of course, see their premiums go up by a large amount. That tends to be people who live in rural areas. The eligibility cliff will also disproportionately hurt older Americans. It will hurt people who are self-employed. It will hurt small business owners. Now, these are folks I've been talking about who will lose coverage or eligibility for the tax credit in its entirety. There are many people who will remain eligible, but what they're eligible for will shrink dramatically, and their premiums will skyrocket too. Analysis from the Urban Institute finds that people under 250% of the federal poverty level will see their premiums in the individual market more than quadruple. For people from 250% to 400% of poverty, their premiums will go up by more than double. Costs are far too high throughout our healthcare system, but right now, millions of Americans are seeing massive increases in their 2026 premiums. Millions of Americans will become uninsured because their coverage is becoming unaffordable. All of this is directly the result of a policy choice, the choice to let the enhanced credits expire. Thank you.
Thank you.
Thank you, Ranking Member DeSaulnier and Ranking Member Scott, to the members of the committee and to everyone who is here today to talk about this important topic. My name is Katie Berg, and I'm Senior Director of Federal Affairs at Blood Cancer United, formerly the Leukemia and Lymphoma Society. We represent nearly 2 million Americans living with blood cancer diagnosis in America today, and our mission is simple: to cure blood cancer and to improve the quality of life for patients and their families. Every day, more than 5,000 Americans hear the words, "You have cancer." And because of an extraordinary scientific progress, many of those patients have better treatment options and better prognoses, better chances of survival than ever before. But scientific progress means nothing if patients cannot afford to access it. Right now, millions of Americans are weeks away from losing the coverage that makes this care possible. We are approaching a catastrophic deadline, the expiration of the enhanced premium tax credits. For 22 million Americans, these credits are the only reason comprehensive health insurance is within reach. And if Congress allows them to expire, we will see huge spikes on January 1st. Let me make this real. John in Texas will pay $122 more each month. Kristen in Maine, $162. Brandy in Georgia, $220 more per month. Jill in Connecticut, more than $1,000 per month. And Kenny from North Carolina, a blood cancer patient and advocate for Blood Cancer United, will pay more than $1,500 more each month for his care in 2026. We are just weeks away from these increases hitting millions of other American families. These aren't abstract numbers, but for a patient undergoing chemotherapy or for someone managing a chronic illness, $200 or $1,500 a month is the difference between staying insured and going without care altogether. Some have suggested that Congress should use the next few weeks to scrap our current tax credit system entirely and design something new from scratch with new rules, new systems, and new unintended consequences. But patients living with cancer and other serious illnesses do not have the luxury of waiting. Their lives cannot depend on whether Congress can build a replacement program in time to prevent millions of people losing their coverage in just a few weeks. On their behalf, I urge you to extend the enhanced premium tax credits now. Give families the certainty they deserve and give patients the lifeline they need. I also want to highlight another issue that is critical to affordability, which is health savings accounts. HSAs are a powerful tool for some Americans, tools that promote savings, plannings, and flexibility, but they only work when paired with insurance that patients can actually afford. If a premium spikes and patients lose coverage, an HSA is meaningless. And for people with cancer and high deductible health plans, they often shift costs onto patients right when they are most vulnerable. It is clear to us that any plan for reform in our system take into account the highest utilizers, the highest need people who have cancer, and make sure that that system will work. Once Congress prevents this premium cliff, we stand ready to work with Congress on long-term reforms that lower costs for everyone, including patients, employers, and taxpayers, and we have already done so with the help of this committee. Thank you. There are many bipartisan ideas out there that will do just that, promoting competition, curbing anti-competitive practices, increasing transparency, and reducing drug and insurance middlemen and the distortions that come along with them, as well as strengthening market protections. We want to partner with Congress on all of them, but the test for any cost-saving idea for patients is simple. Does it help or harm the people that need health care the most? If a proposal raises costs for patients with cancer, weakens protections for people with pre-existing conditions, or makes it harder to access treatment, we are moving in the wrong direction. If Congress makes the wrong choice, more Americans will face unpayable medical debt, more will be forced into bankruptcy, and more will shutter their small businesses. More will lose their lives, not because we lack cures or treatments, but because they cannot afford to reach them. We are at a crossroads, and Congress can protect the people who rely on this system the most, or it can allow the expiration of these tax credits to push millions of people out of coverage. For us, the path forward is simple. Protect patients and extend the tax credits. On behalf of the nearly 2 million people living with blood cancer in the United States today, I want to thank you for your commitment to highlighting this issue and ensuring Americans everywhere have access to high-quality insurance. Thank you.
Thank you, Ms. Bell. Second.
Good afternoon. Thank you for the opportunity to speak with you today. My name is Tori Baggett, and I live in Pittsburgh, Pennsylvania. I am the owner and sole operator of a letterpress printing business, making greeting cards, prints, and other paper goods. Money is already tight because I am just getting the business up and running fully, and on top of this, my husband and I hope to start a family soon, which will make it even tighter. I'm entering into my third year of Penny coverage. Penny is Pennsylvania's ACA marketplace, and it is without a doubt the right choice for my circumstances. My husband's employer-based coverage would cost us more than triple what I'm paying now, a staggering $600 a month to just cover me. Through Penny, I have a plan that meets all of my needs, and that is especially important because I have a chronic illness that requires regular specialist visits, testing, and medications. Also, as I mentioned, starting a family, prenatal care, and family planning are also covered, which is a huge relief. As I am building my business, the extended tax credits are helping us stay afloat. Right now, I pay $197 a month, but if the tax credits are not extended, the coverage will go up to $365 for the exact same plan. We live frugally, but even so, without these tax credits, my choices for health insurance would involve choosing less coverage or financial sacrifices elsewhere. The financial burden of paying for the health care I need would involve a second job, pushing back or rethinking starting a family entirely, and possibly not being able to afford the specialist care that keeps me healthy and able to work at all. I consider myself to be a very average American. The fact that I am facing a near doubling of my coverage makes me worry for those who are losing these tax credits. That puts their premiums in the multiple thousands, especially those without the supportive community that I have. My life will instantly become harder if Congress fails to renew these tax credits. Thank you for your time.
Welcome. Thank you. Ms. Winter.
Hi. Thanks so much for...
Is it on now? At a local university. I think it's important to remember that access to non-employer sponsored health coverage allows people to make different decisions with their professional lives than they might otherwise if they are forced to find a job that offers benefits. My husband and I both intended to pursue full-time tenure-track jobs in academia. In 2020, when the pandemic caused seemingly indefinite hiring freezes right as we were at the stage of our lives when we could finally get a tenure-track job, all of those jobs went away, and many of them became adjunct positions. Adjunct positions very rarely turn back into tenure-track positions, and we made the decision to change our professional plans and change careers. We decided to move home to Virginia and to be closer to family, and we could not have made that decision without access to ACA coverage. We have two children. They're 7 and 4, and both have health conditions that require seeing specialists multiple times a year. I have health conditions that require seeing specialists multiple times a year. In 2025, our monthly premium was $544 a month for a low deductible plan for a family of 4. Right now, we've signed up for that same plan, and it has gone up to $842 a month. I am worried that we will hit that 400% of the poverty level cliff if nothing is done, and we won't get any subsidy at all. We've been lucky because both of our businesses are doing much better this year than they did last year, which is a blessing, but not if it kicks us over that 400% of the poverty level line. If we don't have any tax credit at all, our monthly premium would be $1,552 a month. And we can't afford that, and I don't know what we will do. I appreciate the effort that this committee is making, and it's really heartbreaking to see that the entirety of Congress is not trying to solve this problem and pretending like it's a political football to score points when people's lives are in danger. So thank you.
Well said. I will go last since I kept everybody waiting. And Ms. Bonamici, if you want to start, well, if you could handle. Thank you, Mr. Courtney. You're a gentleman. Sometimes.
Is this on? Well, thank you so much to Mr. Desaulniers, Ranking Member Scott, and all of you for holding this really important discussion today to highlight the urgency of permanently extending the ACA premium tax credits. I'm Suzanne Bonamici. I represent a district in Oregon. And this Republican agenda, it's dramatically increasing premiums. At least 110,000 Oregonians and maybe more. I've been hearing from my constituents who are pretty terrified about the consequences of this unnecessary crisis, what it's going to mean to them and their lives. And when you add this on top of the cuts in the big ugly bill, and you add that onto an already fragile healthcare system, there is a lot of angst. So Tara is from Portland, and she contacted my office, and she said her family's health insurance costs on the marketplace are going from $620 a month to $1,800 a month. And then Stacy lives in St. Helens. It's a pretty rural community north of Portland. She and her husband are both self-employed. They're in their late 50s. Their premiums are going to more than quadruple. They pay right now $539 a month, and their premiums are going up to they're going up to $2,396 a month. I did the math, $1,857 a month more. They don't know what they're going to do. And millions of Americans are experiencing that same fear, that uncertainty. And, this is the United States of America, as we heard. Nobody should feel scared to get sick or hurt. And we could solve this crisis today if the Republicans would just bring a bill to the floor to extend the subsidies, but that's not happening. I don't know if they don't care that your premiums are becoming unaffordable. They don't care that you may have to choose between paying for coverage or putting food on the table or paying your mortgage or your rent. They certainly don't seem to care if you can't afford insurance with the steep increases and then are forced into bankruptcy if you get sick or injured. And I don't know what it is with this sort of heartless obsession to get rid of the Affordable Care Act. I wasn't in Congress when it passed. But every Congress, it seems like they're trying to get rid of it or dismantle it or minimize it, when in fact we should be strengthening it. They don't really have a good alternative either. That's what's so tough. They've had a lot of time to think about it, but they don't have anything. So I just want you to know that Democrats here in Congress, we're fighting to protect health care. We need Republicans to join us in this crisis, and we know that the American people deserve better. And I want to ask a question. First of all, to the small business owners, thank you for being here and representing that voice. And one of the benefits of the ACA is to have that marketplace for my son's a small business owner. I know a lot of small business owners. That gave them the freedom to be able to open a business because they could get insurance through the exchange. But I want to ask Ms. Berga, so many people are affected by cancer. I can't think of anyone who doesn't have somebody in their family or friend or circle. So what might be the estimate of the out-of-pocket costs that cancer patients would have to pay if they didn't have coverage? Because a lot of people they'll go without coverage. So what's going to happen? What are the consequences to cancer patients if they can't afford their treatments?
Thank you, Ms. Bonamici. As far as I'm aware, there's no such thing as a self-pay cancer patient. In just your first year after diagnosis, somebody with leukemia, and these numbers are several years old, their prices mount more than $500,000 in just the first 12 months of treatment. We also know that even those with insurance, 41% of cancer patients exhaust their entire life savings in just the first 2 years after treatment begins. And so we know that not only are the health consequences huge for patients, but so are the financial consequences. And we have had conversations with families who have had people in their family hide their diagnoses, hide their treatment, and push off their treatment for fear of putting fiscal ramifications on their families. And so the costs, I don't know what the costs are for somebody who doesn't have insurance, because they're likely not going to get it.
Thank you. And it's not just a financial cost, it's a cost to their family. And well, thank you again. And as I yield back, I just want to note that I sat in the Rules Committee and offered an amendment to the continuing resolution to extend the tax credits for 3 years, and they didn't vote for it. But I heard a lot of Republicans said, "Oh, this money is just going to insurance companies," which was an interesting argument for them. And I sort of invite them to consider Medicare for all if their concern is about too much money going to insurance companies. Thank you, Mr. Chairman. I yield back.
Beth, you're next.
Surprise, surprise. I'm thinking seniority, I would be the last. But anyway, thank you so much to our panelists that are here today. We really, really appreciate you. Thank you to our ranking member, Mr. Scott, and also Mr. DeSaulnier for holding this shadow hearing today. I just want to say, we know that time is running out. It really, really is. There are 22 million Americans who are depending on tax credits that have helped them save thousands of dollars every year on health care premiums. And if I had a dollar for every constituent that I have spoken to of recent that is so concerned about, not having the extending of the tax credits, if I had a dollar for every family that I've spoken to that has said, we don't know what we're going to do, I would be wealthy by now. That is what I hear each and every single day. What are we going to do? So in less than 2 weeks, people who rely on the ACA marketplace, they're going to lock in health plans with premiums, as you've expressed, that have either doubled or tripled according to what they paid last year. And earlier this fall, we watched as this Republican leadership, as it was just stated by my colleague, reach historic new lows. For 43 days, Speaker Johnson refused to call a vote or to come to the negotiation table to discuss how we can preserve health care coverage for millions of Americans, hardworking Americans, that it is their right to have access to health care. And as we all count down to the holidays now, this is the looming question that everyone is asking. Every family is concerned about what is going to be the future of health for their family. And they're watching the Republicans just continue to run down the clock on the subsidies that are going to make health care far more affordable for everyone. As the Republicans continue to delay, what does this mean for our families back home? And we've been listening to our constituents. We've been listening to our families, and they're scared to death, and they have every right to be so. It means health care premiums for next year, they've already spiked. They're going to continue to spike. Millions who've logged onto the ACA marketplace have been left in the lurch. They've truly been left in the lurch, wondering how are they going to afford the life-saving medications that they need. I'm a 2-time breast cancer survivor myself. And trust me, there's not a day that goes by that I don't think about every family or any person in this country that is afflicted with cancer or any other devastating disease, and trying to figure out how am I going to continue to take my medications, pay for my medications, pay for my treatment. I think about that all the time because I have been in the system, and I know that I was very blessed and fortunate to have access to good quality health care. But what about all the people now that are not going to have access to the health care that they deserve? It means parents already operating on a shoestring budget, they're going to have to stretch their dollars even more so to make ends meet. It means small business owners, such as yourselves, will have to choose between their health care and their livelihood. That's un-American. That's not right. It means young adults they're going to forego their health care because they believe that they're healthy right now, gambling on the hope that they're not going to have a medical emergency, and because they just simply can't be concerned about being saddled with medical debt. This inaction by national Republicans is going to force families to make these very hard decisions, and we've heard this over and over and over again by our constituents. It just really strains their wallets, and it's not fair. It's going to worsen the affordability crisis that already exists in this America, in Trump's America. So I just want to say that, I appreciate you being here today. I really, really do, because everybody deserves the peace of mind to know that they have the health care that they deserve, to know that a diagnosis is not going to mean that they're going to be saddled with crippling debt, medical debt, and to know that they can afford to take care of themselves and look after their families. For one of my neighbors in Georgia, I represent Georgia, his name is Rich, and I've been talking about him lately, that he's looking after a family of 4, and he's struggling already to pay the bills. But what he says is, and I'm going to quote what he says, I'm a self-employed sole provider for a family of 4, where 2 of us have pre-existing conditions. Most of our medical expenses are out of pocket to begin with, given the nature of our illnesses. If Republicans get their way, he says, my very basic catastrophic plan style HMO will literally increase tenfold. I'm currently spending 39% of my income on health care. And I'm end quote. So there are more stories like this that we are hearing from our constituents every day, and many more are to come. They're going to come if Republicans have their way and are not creating something that is sustainable for people to get the health care and to be healthy as they deserve to. Ms. Burge, my question is to you. How would the expiration of these ACA tax credits impact those that are living with chronic illnesses, since you deal with those that are living with blood cancer, and they're getting their health insurance from the ACA marketplace?
Yeah, it's something that we're confronting on a daily basis right now. Our patients and our advocates are afraid of not being able to afford their cancer treatments. They're afraid of losing hours and life with their families and loved ones. We know that a number of them are considering transitions in jobs, even moving, because they feel insecure in their ability to afford their health insurance. They're making life and death choices. We know that many cancer patients, as well as many other people with chronic and serious conditions, cut their pills, don't visit the doctor as often, that they don't get the scans that they need, don't get the follow-up care, and the implications and the consequences when you have a disease like cancer can cost you everything, literally everything.
Mm-hmm. Thank you. And my second question is for you, Mr. Giovanelli. With skyrocketing premiums, many young and otherwise healthy folks, as we've discussed, are going to choose to opt out of getting any health insurance. What will this mean for the future of the health care economy?
That's an excellent question. And, the ramifications are really very broad. I mean, they're significant for the young folks who, understandably might not think that they need coverage when they're young and they're feeling healthy. But of course, folks get sick, accidents happen, and then people are left in a position where it changes the whole course of one's life because of not having the coverage that they might need. But more broadly, though, when you have huge increases in the cost of coverage, what you see, at least on average, is it's the folks who are healthy at the moment who don't necessarily think that they need the coverage right away who are going to be the first people to drop that coverage. It's going to affect people across the board, and lots of folks are going to be put in a position where they can't maintain the coverage, but particularly, I think, younger and healthier folks, people who are healthy right now. And so when that happens, it actually causes a really difficult position for the entire insurance market. So if everybody who is healthy starts to leave the market, then costs go up and up for everybody else. And so really it really throws into unbalance the stability of the insurance markets more broadly, and everybody who relies on comprehensive coverage and who needs it.
Thank you very much, and I yield.
Thank you, Mark, and thank you to the witnesses for being here. And just want to share with the witnesses that actually this committee was one of the 3 standing committees back in 2010, which actually drafted the Affordable Care Act. Mr. Scott and I were at some of those meetings there a long time ago. But again, this is the committee that has jurisdiction through the Employment Retirement Income Security Act, ERISA, which again is really where the majority, actually the large majority of Americans get their health insurance. And many of you, again, are describing exactly that market that's here. When the bill was being drafted, one of the 3 big reforms was elimination of pre-existing conditions, which Mr. Giovanelli mentioned, the age 26 coverage that allowed kids to stay on their parents' health plan. Because it was either, you got your diploma at age 21 along with a premium notice that you were being canceled from your parents' health insurance plan. We extended it to age 26. And also the elimination of lifetime limits, which was, again, one of these really barbaric rules in the insurance market, which, again, really hit cancer patients and people with chronic injuries and are wildly popular, all 3 of them, with the American public. The tax credits that were enacted initially actually were a little better than 400% of poverty, but over time, and Bobby knows this as well, through budget negotiations, they kind of chipped away at the subsidies, and then we ended up with this cliff, which, again, you described very well, that, created a real frustration for a lot of people who, again, once the support disappeared, it really, again, put them in a really tough position. So enacting the enhanced premium tax credits has been just another really successful step forward. I think it was about 11 million people were on the ACA exchanges nationally in 2021, and that has grown to around 24 million. And that's really, again, just sort of sets the metrics in terms of what is at stake right now in terms of turning the clock back to those prior tax credits. So again, the clock is ticking, as my colleagues have said, and we have stories from Connecticut. Jill from Connecticut that you mentioned, also she lives in my district in Niantic, and contacted our office. $1,000 per month increase. Again, it's just it's not even unaffordable. It's impossible for people to really be able to manage that. But, one thing, Mr. Giovanelli, I wanted to ask about is that, you already see this now in the press, that sort of the post-enhanced tax credit world, which, people are already starting to sort of talk about, is that short-term health plans may now sort of emerge as somehow a solution for people. And again, these are plans which are from 12 to 36 months under the Trump administration in terms of, so they're really not short term, but really all the patient protections really are very shaky, if not non-existent. So maybe you can just sort of talk about that's not really a solution for our witnesses or a lot of Americans who might think that, well, I can still, find an insurance plan that works.
Thank you for that. Yeah, I mean, there are several types of insurance products that may have their place in certain limited circumstances, but fundamentally they are not a substitute, not intended to be a substitute for comprehensive coverage. And short-term limited duration coverage that you just mentioned is a prime example. It's in the name, right? Short-term coverage. It's a product that's supposed to fill a gap between one comprehensive coverage and another. It doesn't have to follow any of those consumer protections that we talked about, plus a whole many more that we didn't mention here today. It can just flat out deny you for coverage if you're sick, charge you more, let you on the policy, and then go back and find that maybe you were sick and we're going to yank the policy now. It's not a substitute for the type of coverage that we're talking about today. And the issue is, I think, these plans have a low upfront premium for those people who can sorry, on the microphone there, can be initially attractive because they have a low premium for people who are healthy, but then you actually have to use the plan, and again, it's not there for you in many circumstances, and so folks really might be casting a wider net because of all of these challenges to affordability for the marketplace plans, but they have to be so careful and really be aware that it's those plans that have to follow the consumer protections that will where these tax credits are available is the kind of coverage that is what you should look for. Thanks.
So, thank you. I mean, it shows there's really no easy off ramp here. The simplest solution is, as we've heard, is just extend the premium tax credits. By the way, Kaiser Family did a polling on that particular question. 8 out of 10 Americans support the proposal that you're presenting here. So what you're asking for is nothing out of the mainstream. In fact, there's large Republican support. Republican Americans and citizens out there that actually support extending these tax credits. I yield back.
Thank you, Mr. Courtney. Mr. Scott.
Thank you. Thank you. When I discuss the Affordable Care Act, I like to start with what things were like before. Obviously, it's not nothing's ideal, but before, if you had a pre-existing condition, you couldn't get insurance, or if you did get insurance, you had to pay extraordinary amounts. There's no essential benefit guarantee, no list of essential benefits. Women paid more than men, lifetime benefits. And the annual inflation was just off the chart. I heard Republicans were just outraged that the Affordable Care Act hadn't worked because costs have doubled in 15 years. Well, if you do the calculation, doubling in 15 years, that's an annual inflation rate of less than 5%. Mr. Giovanelli, can you recite what the annual increase was before the Affordable Care Act?
Thanks for that question, Ranking Member Scott. I'm not sure what the number was prior to the AC, other than that it was very large. Well, I mean, 10 and 15% a year were not unusual. I wouldn't think so at all, no.
Okay, so I mean, that's what it was before. And to complain it's 5% we wish we had 5% before the Affordable Care Act. Katie, you mentioned the cost of getting a diagnosis. We're talking about insurance. If you get hit with that out of the blue, if you don't get hit with it, you don't need insurance, but you have insurance to protect you from those kinds of things. How often do you run into somebody that has a health savings account that can cover the costs of that kind of diagnosis?
We do not run into those people.
They don't exist. One of the things that we've talked about is the cliff. If you go over the cliff, you've got to pay sticker price. You don't get any help at all. What is the cost of a single individual policy or a family policy right now? That they would have to pay the full cost and without any premium support?
Mine would be $15.52 a month.
Say again?
Mine would be $15.52 per month.
And that's for 2 people or 1 person? For 4? Okay. And one thing people don't talk about is the effect. Mr. Giovanelli mentioned what happens when healthy people drop their insurance, and you can count on it. The people that drop their insurance have one thing in common: they're all healthy. Yeah. If they're sick, they're just going to come up with the money because they cannot afford to be without insurance. That increases the cost for everybody else. What other effects? If you're not on the marketplace, so you live in a rural area, what effect does a lot of people going uninsured? What effect would that have on you if you're in a rural area?
Well, again, I think across the board, the smaller that market gets, the worse it works for anybody who has to use it. So costs go up. Disproportionately, folks in rural areas have a range of other cost issues when it comes to health care, when it comes to dealing with the side effects of consolidation among providers, other access issues. And so whenever you introduce another destabilizing factor like the loss of the enhanced tax credits, I think you're just making it that much harder for folks to access the care they need.
What about the viability of rural hospitals?
That certainly can be put at risk when you have deteriorations in the market here.
And generally, when you have more uninsured, what does cost shifting of indigent care mean?
More folks not getting the care that they absolutely have to have.
And the cost shifting, who pays?
Ultimately, taxpayers.
Or other people?
Yeah.
Because when you go to the emergency room and don't pay, the next person that comes in with insurance will get charged a little extra. And so even if you're not on the marketplace, if you're creating a lot of newly uninsured people, everybody's insurance, whether you're on the marketplace or not, will take a hit. And so employers will see this when they talk about the marketplace newly insured because of the marketplace increases and the cuts in Medicaid. We'll see those prices skyrocket as a direct result. Thank you.
Thank you, Mr. Scott. I want to ask our two small business owners. You spend a lot of time. I remember when I owned small businesses and restaurants. Reporter asked me how many hours I worked, and I said all of them. That's how I get my color of my hair. Restaurants run a very thin margin, but you look at your financial statements. So what are some of the decisions you are thinking about right now? I know when I provided health care for my employees, and a lot of them were younger, I can remember one manager in particular coming and crying because she wasn't aware of the copay when she finally needed hers. So when you look at your small business, and there's this perception in this institution by our colleagues on the other side that they are the defenders of small business, I have found that not to be the case. So when you look at your financial statements, Tori, if your costs go up and this impacts your employees, where do you make up the difference, and where do you find employees who will come to work for you full time?
I do not have employees. It's just me. I'm owner operator.
Speak for yourself.
Yeah. So for me, it means like if there's no money to be had. Basically, the margin is zero. So every dollar counts. Right now, especially since I'm a relatively new business as well, I'm just trying to find clients, and it's a very niche business that I run to. And I'm a maker. I make things with my hands. If I'm not healthy, my business doesn't go. So, and again, I said I have a chronic illness, and keeping on top of that means I have to have the coverage. So my premium is nearly doubling, but I have to have that coverage because I have to keep seeing the team of doctors that I've worked so hard to put together. So that's what it is.
Oops.
Thank you. I do have a small team of employees. I've been fortunate enough to be able to expand a little bit this year, and I hired a virtual assistant because I have recently diagnosed ADHD, and I'm not very good at the administrative tasks. But I love what I do. It's a valuable service that, my clients thank me in tears at the end of their births, and I want to keep doing it. I have been contemplating going to nursing school because I would be able to get a job with benefits, but I really, really, really don't want to be a nurse. Now apparently nurses aren't going to be professional degrees, and the loans that I might be able to get is a whole nother thing. So, I don't know what we'll do. I really don't. I don't have another $1,300 a month to spend on healthcare. So
I wanted to sort of follow up on the ranking member's comments. I was out at my county hospital. I used to be a county supervisor. I was deciding vote to build that hospital many years ago, and I was talking to our emergency room doctors there, who are the main place where indigent care goes in California. They're required to do that. So in combination of what the Republicans had done to the system to begin with, in the big ugly bill, and then this, we really worked hard in the East Bay, the Bay Area, to have the public systems work with our private systems dominated by Kaiser, because that's where Kaiser started. Half of the 3 million people who live there are Kaiser patients, but it's a closed system and it's not for profit, so it's pretty efficient. But when you pull these out, I had a roundtable with all of the stakeholders and the CFO of the one private hospital chain, always in the top 20 in consumer news reports. He just said, if all of this goes into effect, we'll have to close our hospitals. So my question to you is, we were getting to a more efficient system where we were investing in primary care clinicians, prevention, and getting them out of crisis care in the emergency room. So talk to us a little bit about the inefficiency of what is already the most expensive healthcare system in the world for developed countries with the lowest outcomes. What does this do on top of all that? How's that for a really grim introduction to a market?
It is grim. I would say again that I think this adds it's an own goal, just something that makes things that are already complicated and challenging even harder for folks. And of course, the brunt is not borne equally, right? When you make these changes, you're hitting folks who are already feeling a pinch. To me, when I think about all of this, I think that fundamentally there are huge issues and inefficiencies and cost issues that we have to deal with, and lots of continued thinking that needs to be done and done by this committee and elsewhere. But right now, we're dealing with 20-some million folks who fundamentally are seeing their premiums increase right now because of one decision that hasn't been made. They are downstream of everything else, and they are not in a position or nothing else ultimately right now is mattering for them and their ability to afford the coverage that they need. They're downstream from all of that, and there's just one kind of basic thing that they need, and that's sort of what I'm focused on.
And when you look at other developed countries, which I asked my Republican colleagues for years, okay, where is this healthcare nirvana? What developed country in the world doesn't have some kind of public investment? Much better than we do.
I don't know that there's a nirvana anywhere out there, but certainly, it continued to have significant public investment in all of these areas is critical.
As, like Ms. Macbeth, a survivor of cancer, but having survived stage 4 chronic lymphocytic leukemia, and having learned about why I survived and the pills that are in my pocket, that before the Biden administration in the United States cost about $300 a day, even though all the basic research had happened at the NIH and the National Cancer Institute. But because of our efforts to actually negotiate those prices, they're now about $90 a day, which is the same as the EU. It's $37 a day in Australia. And then Johnson & Johnson carries it. Now, 90% of the basic research was done at taxpayers' expense. And then they came along and changed it and marketed it a little bit. But when I asked executives at Johnson & Johnson why it was so different, the answer was because you let us. And basically, we were subsidizing lower cost. That's my interpretation of what they told us, because the rest of the world doesn't let them. Well, the Biden administration, we changed that. And all we did was say Medicare and Medicaid is going to negotiate the best value. But we, American taxpayers, developed most of the research in this case, and then we subsidized lower costs because of the inaction of Congress. So the difficulty of being a cancer patient, I remember when I was first diagnosed, 1 in 4 words you retain. So you almost have to have somebody help you through this, right? Because your family members. So talk a little bit about trying to move, having all these wonderful discoveries in the field that have extended people's lives. And I remind my Republican colleagues that Richard Nixon started the war on cancer, or at least took credit for it. So all of these diminished, in this now is the ultimate, how do people and families get the services that are right there for them to get?
It's a good and also frustrating question. Investments in research are critical to our mission to helping support cancer survivors, turning more people who are diagnosed with the cancer into a cancer survivor. And so investments in NIH research are a huge priority of ours. That said, what I said in my testimony about you can invest all you want in research, but if you cannot make them available to patients, then what is that research actually in service of? And so when we think about how do we improve systems, it's about how do we take this drug, this treatment, this therapy, and put it into hands, and without mechanisms to do that, which right now, as in our country, is insurance, then we need to rethink holistically how patients and families help support one another, because right now it's a fight. We have a bunch of patients call every day and talk about prior authorization, about how they don't have access to clinical trials, about how they are forced to jump through hoop after hoop after hoop with everything related to their care. And so making sure that we look at this holistically about not only what can we do about drug prices, what can we do about the quality of insurance, what can we do about access to those treatments is something that we're very focused on.
I'm always grateful, and my kids are too, because if it wasn't for those researchers, something that was very deadly 20 years ago is now completely treatable. Ms. Lee, do you have any?
That was such an abrupt end.
I come late and I leave early.
Well, thank you so much, Mr. Ranking Member, for holding. I do appreciate us holding this meeting. I've, of course, only ever been in the minority, so to see us doing productive work, when we see what our committee has been doing, right, the amount of hearings to figure out how we can better dismantle public education or prioritize corporations over workers. It's just, we know what folks really want and need us to not just discuss, but to prioritize. Healthcare is right at the top of that list. And we know that even before we came up on the deadline for the ACA tax credit, the extension, we already know that we were already in a crisis. Now we're entering a catastrophe. Right now, Americans are going bankrupt for basic care. Incidentally, I have a family member who has blood cancer, and they're doing all right. But the problem is that they have, of course, this life-saving drug that was $10,000 a month. And they recently showed me the newest bill. It's covered through insurance, but the newest bill that is at $20,000 a month. And I had to not just double take that, I had to stare at that. The $10,000 a month was already incomprehensible. $20,000 makes no sense at all. They always ask me, every time they get a bill, they're like, how do people afford this? And the answer is that for so many, they don't. For so many, they go without care. I think about how many people, and it's not just the people who need immediate care. I think about all the people who are in a job that isn't the job of their dreams. They work 9 to 5 and they're there because of their ability to have health care. How many people would leave that job and start a business or go into a career field that really sparks joy for them, but they're not able to because that is a cost-inefficient route for them. We're stymieing our own growth and ability because we have a healthcare system that is tied to employment. I think about people who are rationing care. We're rationing care in the United States of America, the wealthiest nation on earth. We're rationing care like folks have had to ration food during depressions. And not enough people are batting an eye about that. We are the only wealthy nation on earth that has not figured out a healthcare for all system, a Medicare for all system. So I wanted to bring that up because while we recognize that our immediate goal is that we need to ensure that the ACA tax credits are extended, we have an immediate responsibility with a January deadline before so many people lose their health care. I wanted to make it clear and known that we also have a responsibility of fixing this system, that we have to plan now for a future where Americans are no longer rationing care. We have to plan now for a system where Americans are no longer dying of curable diseases or figuring out if they'll take their diabetes medicine or if they'll pay their rent we not only have a responsibility to do that, but we also know that it is actually cheaper. We have data that shows us that we can implement a better system that covers all people in this country. People fundamentally want us to fix the system. One of my constituents traveled here from Pittsburgh. I'm so excited to see you, though, of course, not excited about the reason that I had to see you, but traveled to Pittsburgh because they needed us to know how important it is that we fix the healthcare crisis. And in the immediate short term, we understand why we're here. So I'm grateful, Ms. Baggett, Tori. And I wish that my Republican colleagues were here to hear your testimony, to hear all of your testimony today, to hear your lived experience and your professional expertise on this matter, while instead they would rather shut down the government for the longest amount of time in history instead of solving a problem that impacts not just our constituents. They're not keeping us from the ability to serve and to save our constituents. It's actually their constituents who are being harmed at a much higher rate even than our analysis from the Center for American Progress found that 9 out of every 10 low-income American who is enrolled in marketplace coverage lives in a state that voted for Trump, which means that they know that they're harming their own constituents, and they are deciding that the cruelty is worth it. 24,000 people in my district rely on the ACA tax credits. Congress doesn't act before the end of the month. Families in Western Pennsylvania and all over the country are going to see their already expensive, far too expensive premiums jump by thousands of dollars. A 60-year-old couple in my district could see their premium costs rise by over $12,000. A working family of 4 might face an increase of more than $5,000. So, Tori, thank you again for being with us today, and I appreciate you sharing your story, because we know many others in Western Pennsylvania are facing similar challenges. To start, I want to ask about getting health care through the marketplace, or penny, as we call it in Pennsylvania. We know that there are not endless options for accessing affordable health insurance, and for folks in our district, penny is the only option. Can you share a bit more with us about why being able to access health insurance through penny is important to you?
Yes, thank you for that question. It just gives so many options that are affordable. Like I think I said in my statement that my husband's employer-based insurance is nearly triple what I've been paying. So that is just not an option to begin with. So the marketplace just gives me a greater range of things to pick and choose to make the plan basically that I need, again, because I have specialist care that I need. And I was able to work with someone, through Penny to make the plan that works best for me. And having someone able to do that and not have to figure it out all on my own is incredibly important, especially since I am running a business. I don't have time to figure that out. Yeah. And I think that's probably the same for most people. But again, it's still the most affordable plan for me through the marketplace.
Yeah. And I will say that I know that some of my fellow members of Congress came independently wealthy, right? So having annual premiums increase by a few thousand maybe doesn't sound so dire, but we know that those increases are going to have devastating impacts. So could you share a bit more about how the premium increases will affect your family, and it even to the extent that you know about other folks in your community, how it would affect them, business owners?
Yeah. So for us, again, I have a business that is just starting. I'm not making any money. There's no profit to be seen. My husband works for a small nonprofit, and there's also not a lot of money there. So we're pretty much surviving on a single income right now for the household. So literally any amount of increase in cost is, we're not saving anything right now. There's no savings to be had. So it's right now that seems like a problem. We're okay. We have money to spend on food, but we're not saving anything. And so moving forward, if costs just continue to rise, we're just going to go into debt because of it, because of health insurance, which is ridiculous.
So is there, to wrap up, is there anything else that you would want, because you came all the way here, that you would want Congress to know about the importance of this fight for health care?
Yeah, I think, especially for, again, I think I said earlier, I'm an average American, and I think that the fact that, I am struggling to, grow a business is the goal for most people, is to, own your own business and make you something for yourself. healthcare is like one of the biggest roadblocks for me at this point, and that is something that it shouldn't be. It just shouldn't be in this country. So
Thank you. Particularly, I always say I don't mind how you get there. If you get to the extension of the ACA tax credits, or to hopefully one day Medicare for all, if you get there because you care about the humans and you care about ensuring that people will have the care that they need, that's a great way. If you get there because of cost, fine. If you get there because you believe that small businesses should thrive, that they deserve to exist and grow, fine. We welcome you to this fight. This is already an extremely broken system. Republicans have manufactured one healthcare crisis after another. Just this summer, they made the biggest Medicaid cuts in history to fund trillions in tax breaks for billionaires. When these cuts go into effect, over 17,000 people in my district will lose healthcare. And when millions of people lose healthcare because Republicans eliminate the ACA tax credits, cut Medicaid, and refuse the cheapest and most equitable healthcare model, Medicare for all, they will blame anybody, anything except for their own failed policies. Healthcare is a fundamental human right. We need to legislate now for a future where America is inherently healthier, and that means taking action right now. So I thank you all so much, and I yield back.
Well, thank you, everyone. I really want to thank our witnesses. I want to thank our terrific staff on the committee. Thank you, Carrie and everybody, for putting this together. Yes, it takes a lot of look to make some of us look good, so I appreciate it. But this just onslaught on America's health is shocking to me on so many levels. As somebody who, according to the doctors at GW, I'm not supposed to be here. I spent 4 weeks on an incubator during COVID. And so I've seen the best and the worst of this system. And it's maddening to me that people in Congress and the President of the United States would want to attack a system that we could all work on to make better so that people could have longer lives and healthier lives. America can and should do better than this. I think of the investments at NIH. For every $1 we put in, we get $2.65 back. And I had this debate on the floor with Chip Roy amongst all people. What's wrong with that? Where in the private sector do you get that kind of return on investment year over year and people being able to live longer, extended lives and be in the workforce and be productive parents and employees? So it's maddening. And at this moment, with just a few weeks left to go, there's nothing but silence from the other side. Okay, what do you want to try? So if people wonder who's to blame for this, it should be very crystal clear. If you can't get health care or you can't keep your business open because of this, the responsibility belongs in the White House and in the leadership in Congress. We have a plan. Representative DeLorde tried to introduce this before we went away. Let's extend the credits and let's get to work on solving our longer term problems. So the responsibility is very clear. It's in the Speaker's office and the leader's office in the Senate, and most importantly, in the White House. You can fix this very easily. We just need a few of you to join us to make America healthier and then to work on the underlying problems in front of us. Thank you all so very much, and I